Today we're doing a hair transplant. Our amazing patient had facial surgery done and she was left with big scars. She has thinning from the old surgery and she has patches of no hair. So what we're going to do today is follicular unit transplant. Now there's two kinds of hair transplant we can do. There's something called FUE where I take out individual follicles, or FUT where I take out a whole strip of hair. Take that strip under the microscope, separate the follicles and move them. In this lady, she doesn't want to shave. She doesn't have very thick hair. Doing an FUE, based on my discussion with her, would not suit her well. She would have to shave the back of the scalp. She would have potential a very long time to grow that hair back, and she didn't want to go through that. She has good scalp laxity. So what we're going to do is we're going to take out a strip of hair end to end. You'll see it in the back where there's permanent hair over the nuchal prominence. We'll stitch that up so there'll be a very fine line in her hair. Will be right adjacent to that small scar, and I'll do a trichophytic incision so hair will go through that scar. So hopefully you'll be imperceptible, but there's always going to be a scar. Then we'll take that strip, put it under the microscope, remove the individual follicles. Those follicles will be removed and transplanted, and we're going to fill in that old scar, and we're going to give her a nice round hairline. Let's do it. All right, friends, now we're going to start with the harvesting of the strip. We're going to cut and remove the skin. First step is we're going to harvest the strip. We're doing a trichophytic incision. What that means is we keep the bevel of the blade down so the hairs will grow into each other. We're going to make it, it's basically an interlocking incision. Now we'll cut above. Yeah, the blade is not perpendicular, it's angled. Now we're gently going to harvest the strip. We'll start with the blade first to start in space. Great, now we'll take the scissors and we're gently going to remove the strip right here. You can see when we do it properly, there's very little to no bleeding. We're staying above the galea, right below the subcutaneous plane. To do this properly, you need high quality anesthesia, a good team who can manage this. The key thing with the local is you have to wait to let the local work. If you just put the local and start working in 5-10 minutes, it's not enough in my opinion. You have to give it proper time so the local can work. Here you go, Fawn. Thank you. Now we'll clip everything together and close it. I'll take the bipolar, and sometimes there's a couple of bleeders that we have to get on. These up the big arteries, just the bipolar cautery on. We want to be cautious of the hair. Now we're gently clipping the tissues together. Now we'll use our suture and we'll stitch everything together nicely. We'll do a running locking stitch. Now we're going to do our nerve block for the front. We're going to have you just rest our head back here. So she doesn't feel the work that we do. We go right at the supratrochlear nerve. Supraorbital. Excellent. All right, friends, what we're doing right now is we're numbing the front of the scalp, and we're numbing the front of the scalp so we can make our recipient sites, and I'll be doing that. So I'm putting local anesthesia with epinephrine to decrease bleeding. You see how the skin's expanding? That's what we want. A lot of space here, so we're able to put the grafts in properly. We'll be making a grid pattern. Now we always make a grid pattern when we do this because the grid pattern decreases the risk of having empty areas or missing a spot. Now some people just freehand it and they do it without a structure, and I don't like that. I like everything to be very precise, very repetitive. So what we're going to do is we're going to make a beautiful grid pattern, and in that pattern we'll go ahead and make our boxes for the hole placement. Right now we're anesthetizing everything. We minimize the bleeding. All right, friends, we're going to start with our transplant. We've made a perfect grid pattern, you can see. We're going to start by making 12 holes per box, and that's going to be where the follicles go. We'll start on the side here. And by doing this grid pattern, we really prevent having gaps. All right, friends, we're doing our FUT, Follicular Unit Transplant. This is our follicle right here. You can see the bulb on the bottom, the hairs on top. We gently take this. We transplant it in one of our recipient sites. We find the recipient site. We gently place it. And let it grow.